My name is Bianca. I'm from Welland, Ontario, and I did my undergraduate degree at Queen's University. I have family who have worked in various capacities in the health system, some on the actual service as in medical staff, and then some who've worked behind the scenes, sort of engineering and just maintenance of the hospitals in general. I remember one of my family members speaking at a family luncheon, coming home and just being very, very concerned that with the cuts to the hospital system, about the services we were providing, not only our medical services, but also like the safety of our buildings, the quality of the infrastructure, and then the programs that we were running. I have a family member who worked in the mechanical end of things and was told we have to keep the temperatures in the rooms and including like the operating rooms and as well as the hospital care rooms at lower temperatures or higher temperatures than advised, just because it would cut costs. It comes down to like, you're wondering, what is the quality of the safety of this? Like if you've got individuals who are receiving surgery, you need to keep temperatures in certain ranges, otherwise, you know, it's unsanitary. Or even in the hospital rooms, like even if you've got senior citizens in there, you know, you want to keep your patients comfortable. They're sick, they need attention. To cut corners, because we didn't have the budgets to, you know, maintain the system as it was, we were, you know, in temperatures that were extremely warm in the summers and not as warm as you'd like in the winters, and it made for a very uncomfortable environment that you could walk into the hospital and you'd notice straight away that, you know, it didn't seem right. And it's very worrisome, especially when you're thinking about those in surgery or in the most vulnerable situations. I think the system has gotten a lot better. You can see investments, even in my own area. We've done substantial infrastructure work. There are, I believe, 2 hospitals in my region that have had new emergency rooms put on. We're going to be building a brand new hospital in St. Catharines that's going to have a cancer center and a whole lot of great development, which is great for patients, especially in Niagara, who for a lot of services that were like the big services like cancer and dialysis would have to leave the region entirely just to even get the services because they weren't available there. There were no investments in providing services for like the last, I guess, 10 years prior to around now. It's so encouraging having family members who've been working on both ends of the system to see, you know, we're investing in our healthcare, we're building hospitals, the quality of services are improving. I have, in my family, I had an aunt who had a procedure that my sister now has to have done, and it's about 10 years difference from when my aunt had it done and my sister's having it done this year. It being the exact same procedure, all other things remaining equal, the wait time is down. The organization of the service is so much better. Every appointment that she's going to need that's a follow-up appointment for the next year is already set. Everything is done. We know when all the appointments are going to be. We know that the MRIs are booked and everything is already set. And you know, when it's within your own family and you can see the difference that it's making when you're having all these haphazard answers 10 years ago and you're so frustrated, and then you hear that someone else in the family has to go through the same thing. You're just thinking, oh God, I can't deal with this again. It's so encouraging to be pleasantly surprised by the system. And with healthcare, keep investing. It's the greatest and most important service that we provide, I think, or that we need as a people in this province. And you know, building those hospitals and, you know, investing in our medical centers is so important, and also being innovative, making sure that we have the treatments that are top of the line and that we can get people the best services that are available. I'm Bianca and I speak to health.